How do you recognize a myoclonic seizure? Imagine feeling a sudden jolt or twitch that happens out of nowhere. That's often what a myoclonic seizure looks like. These seizures are brief, involuntary muscle jerks that can happen suddenly and unexpectedly. They usually affect muscles in the arms, legs, or face, but sometimes can involve the chest, back, or abdomen. The jerks are often described as shock-like or twitching movements. One key feature is that they are very quick, lasting only a second or two. Sometimes, a person might experience just one jerk, but in other cases, several can happen in a row, especially upon waking up in the morning or after a nap. Most people stay fully conscious during these episodes. They are aware of what's happening and can often tell someone that they suddenly felt a quick muscle jerk. Because these jerks are so brief, they can be mistaken for normal muscle twitches or twitches caused by fatigue or stress. However, if these jerks happen repeatedly or are associated with other symptoms, they might be signs of an underlying epilepsy condition. Myoclonic seizures are most common in certain types of epilepsy. For example, juvenile myoclonic epilepsy usually begins around puberty and often causes jerks shortly after waking up. Other epilepsy syndromes, like Lennox-Gastaut syndrome or progressive myoclonic epilepsies, can also include myoclonic seizures as part of their symptom set. Sometimes, these seizures are just one part of a broader pattern of different seizure types. To recognize a myoclonic seizure, it's important to pay attention to when the jerks happen, how often they occur, and what might trigger them. If someone experiences sudden, unexplained muscle jerks, especially in the morning or in clusters, it's a good idea to seek medical advice. A healthcare professional will usually ask about the person's medical history, family history of epilepsy, and may suggest tests like an electroencephalogram, which records brain activity. This test can show patterns in brain waves that are typical of epilepsy. Sometimes, imaging tests like MRI or CORT scans are used to rule out other causes, and blood tests may be done as well. It's also important to understand that not all muscle twitches are seizures. Many people experience harmless muscle twitches, known as myoclonus, which are not related to epilepsy. The main difference is that myoclonic seizures are caused by abnormal electrical activity in the brain. That's why an EEG test is so helpful in confirming whether these jerks are part of epilepsy. If you or someone you know is having these sudden muscle jerks, it's essential to get evaluated by a healthcare professional. Only a doctor can determine if these episodes are myoclonic seizures and recommend the right treatment. Early diagnosis can help manage symptoms and improve quality of life, reducing the risk of complications. Remember, each person's experience with epilepsy can be different, so personalized medical advice is always the best course. In summary, recognizing a myoclonic seizure involves noticing quick, shock-like muscle jerks that often happen upon waking and may occur in clusters. If these episodes are recurrent or happen alongside other symptoms, consulting a healthcare professional is crucial. Proper diagnosis and management can make a significant difference in living well with epilepsy.